So what are the symptoms to watch for? Copper deficiency doesn't always shout, it whispers. The symptoms are often vague and easy to misdiagnose. Look out for fatigue, frequent infections, pale skin or anemia that doesn't respond to iron, numbness or tingling in your hands and feet, unsteady gait or difficulty walking, premature graying of hair, brain fog, or memory loss, memory issues. These symptoms don't necessarily happen together. One person with copper deficiency can have brain fog as their main symptom, and somebody else can have fatigue and frequent colds as their main symptoms. Also, the degree of copper deficiency matters. So if you were nodding your head right now as I was listing the symptoms, and especially if you also have got issues, it may be worth testing your copper levels. That brings us to the next section, how to test and treat copper deficiency. Testing is relatively simple. Ask your provider for a serum copper test and ceruloplasmin level. Ceruloplasmin is actually a protein that carries copper in your blood. There are also functional nutritional labs that are very precise, and we use them a lot at our clinic, where copper level is measured inside of the cell. So it's a cellular level, not the serum level. So what to do if your levels are low? If your levels are low, cut back on excess zinc. Address gut inflammation or nutrient malabsorption, and if needed, supplement copper carefully and always under medical guidance. Before or while considering supplementation, try foods naturally rich in copper, such as organ meats, especially beef liver, one of the best sources that most people don't like, unfortunately, shellfish, oysters, crab, lobster, nuts and seeds, especially cashews, almonds, sunflower seeds, and sesame. Dark chocolate, yes, a square of dark chocolate can help. Legumes such as lentils, chickpeas, and black beans. Whole grains like oats, quinoa, and buckwheat. Leafy greens, especially spinach and kale. Mushroom, especially shiitake mushroom, and avocados. They contain a modest amount of copper plus other healthy fats. Remember, on the other side of the spectrum, too much copper can be toxic, so don't guess. Test first. In conclusion, copper deficiency is sneaky, underdiagnosed, and often confused with other conditions. But once you understand its role, how your gut health, supplements, and even medications can affect it, you can take real steps towards feeling better.